Welcome back. Good to see you with the continuation of different types of bed making procedure. If you have not visited our previous videos, right, then you must watch that. In part 1, we have discussed principles of bed making procedure. In part 2, we have discussed simple bed and open bed. In part 3, we have discussed occupied bed, right? And this is a part 4 in which we are seeing different other types of bed making procedure. In this video, we are going to learn about blanket bed. Before starting the procedure, if you are new to this channel, then subscribe it to learn more and more. Let's talk about blanket bed. We should know about the blanket bed. Blanket bed is made for the patients with rheumatism or renal diseases, right? Renal diseases we are knowing in that patient's body is not able to purify the blood and he faces difficulty to drain out the waste products from his body. That's why we are providing blanket bed for such patients, right? In that blanket bed, through the process of perspiration, somewhat waste products will come out of the body. We know in perspiration, lot of waste products come out of the skin. So this bed will allow the waste product to drain out through the skin. So these are the purposes of the blanket bed. In that, number 1, it promotes elimination through the skin. Second one, it makes the patient warm. Number 3, it protects the patient from the weight of the bed linens. So let's see the procedure of blanket bed. First of all, we will stand at the right hand side of the client. Before starting this blanket procedure, every time I used to say, we have to wear cap, mask, apron, then wash your hands and wear the gloves. Then you start the procedure. And as we have seen in our previous videos, all the preliminary assessment we will do for the patients and all the required articles we will collect in our area. After cleaning the mattress and the cot, we will spread this bottom linen. The procedure of spreading this bottom linen you can see in our previous video, right? After spreading this bottom sheet, right, okay, we will take the blanket and we will unfold it like this. Then on the upward direction, then spreading this blanket, we will tuck on the upper side first with the mitten corner and lower side with the mitten corner. After that, we will place this Macintosh under the buttocks of the client. Then on this we will place draw sheet. Then we will tuck on both the sides, first here, then on the opposite side. The reason why we are using this narrow Macintosh and draw sheet, right, is that maximum body part of the patient should expose to this blanket area so that it allows the elimination through the skin perfectly. Patient will sleep. On this, we will place bed cradle over here, which protect the patient from the weight of the bed linen, upper bed linen. See, like this, we have to place bed cradle over this bed, right? And above this bed cradle, we will place again the blanket. And also to give extra warmth to the patient, we can also use electrical bed cradles, right? Or hot water bags. It will keep warmness throughout the bed. One thing we have to take care that while placing the blanket under the patient, the right side of the stitch part should come on the above side, right? And for above blanket, the right stitch part of the blanket should come at the patient's face side, right? Over this bed cradle, we will place this blanket. So now you are watching the complete blanket bed, which is under and over the patient's body, which promotes the elimination of waste products through the skin. In our next upcoming videos, we will going to learn about Burns bed, divided bed, cardiac bed. So keep watching our channel. To learn about simple bed, closed bed or occupied bed, you can see on this link